Regardless of which career path you choose, whether it's radiology or nursing or lab, there are endless opportunities. And what we always tell the kids is you literally, when you graduate from your program, you literally could throw a dart at a map of the United States, and wherever it lands, you can find a job.
I want to get into the medical field because I think it would be fun and a good experience to help save people's lives.
Well, Reach Healthcare Camp is an opportunity for local middle school kids to participate in a healthcare setting, find out a lot about the various professions within healthcare.
The kids are selected through essay and application, and so I go over to the different middle schools. I talk with our contacts who are usually a school counselor or a nurse, and I give the applications out, and then the students apply through application, and they also send in a 250-word essay, and our committee reads over those essays, and we choose the top 10 students that we feel would most benefit from this healthcare camp.
How many tablets you would need to fill the prescription?
We started with the pharmacy, and that was really cool because you get to do the prescriptions of what the patient needs. Like the doctor gives you a prescription and you have to fill the drug and be able to give it to the patient knowing if it's allergic to it or not.
Instead of pills, we used M&Ms, and we had to put 52 in each bottle.
You do how many they need in a day, like how many they take each hour or hourly, and then they have that for an amount of days, and we count that, and we use M&Ms as our prescription, and then you put it in the jar.
It's really hands-on, and they're really getting a sense of the various professions within healthcare.
The doctor wrote a prescription. The medication is sterile blue solution, which is this right here. Directions are give 20 grams by intravenous route, so that's what we talked about, the IV being sterile, and dispense 1 syringe. So here's a syringe for everybody. You are going to stick the end of your syringe in the solution and pull back on the end of the plunger and suck up some of that liquid in there. So it should look something like this.
After pharmacy, we walked over to the cafeteria. The people who cook are really important because they teach what the other people should have, so then they don't have reactions, or so they stay healthy when they're in the hospital.
So we work together with a great team of people. You'll meet some of them when we do a tour of the kitchen, and we all work together to make sure that we have the best food possible.
It was very hands-on. They had a special crepe skillet, and our nutrition services director instructed them on how to build a crepe. They cooked it themselves, and then they actually were able to eat what they had made.
We had to flip them, and I think mine flipped. When it went down, it was on the same side it was before. I don't know how. I think it did a 360. I don't know.
They understood that there are careers within healthcare that aren't necessarily clinical. You know, nutrition services, the dietetics area is an important piece in healthcare.
I've had the privilege to participate in the Reach Healthcare Camp the last 2 years. This year during the Reach Healthcare Camp, we had the kids pretend like they were a patient that had a deficit or a stroke specifically is what we did.
And we chose part of our body to kind of not work. We had a weight on our ankle, and then we had a band strapped around us to have one of our arms pretty much not useful at all. And so we would experience what it's like to be a patient going through after having a stroke. And we did these different things where we walked down the hall and back.
Working with the kids is also, fun. And they need to, that's another thing that we are kind of privileged in rehab. We get to move around and have a lot of fun throughout the day, and I think the kids saw that healthcare can also be fun.
We do all kinds of different parts of the body. We look at all of the solid organs. We can look at blood flow in the legs. We do lots of hearts, the thyroid glands, livers, kidneys, gallbladders. Pregnant ladies, we get to look at their babies inside, which is really exciting.
I got to see my heart, and it's not just a picture or a drawing. That's not a piece of paper that we see in science. It's actually the real thing, and it's cool to see how it works.
It's really neat. Even as an employee, I don't get to see everything that goes on the back end. And so when I'm able to bring students in, when we're able to bring students in and walk through the doors of West Park Hospital, you get to go in through the hallways to where usually you don't go unless you're a patient.
After radiology, which was very fun, we then went on to the ER section and we got tried in the ambulance, which is really fun. I was waiting for that the whole day because that's what I'm most interested in.
We had a dummy and he was like missing an arm and he was breathing really slowly, so we had to breathe for him, and then we had to do CPR.
You have a lot of adrenaline because you have no idea what's going on at first, and when you get to the patient, you have no idea if he's breathing or not, or if he has broken bones or internal bleeding. So it's really teamwork, and it is very exciting.
I particularly watch the faces of the students because they live it. They're not standing back assessing from afar. They are really involved, and you can tell they're living it. They actually have to resuscitate the patient.
But it was pretty cool though, because if that was actually a real thing, a lot of adrenaline would be going on.
Okay, we're gonna analyze him, so quick, nobody touching.
Analyzing now. Stand clear.
Today is really helping me decide what I want to be.
The REACH camp has inspired me more to be in the healthcare because it's just a lot of fun. When the doctors and nurses are talking about it, they're really passionate. You can say that they have a lot of fun in the occupations they have. So I can tell that if I really do want to do this when I get older, I won't be bored and I'll really enjoy it.
I think they should definitely continue this camp because it's very educational and it's good for students to come here and learn, wow, this is what I really want to do, or wow, this is something I totally don't want to do. But I think they should keep funding this because students get a chance to learn all the different types of careers in the hospital, because I didn't even know there was like dietitians or nutritionists that work in the hospital. I had no clue of that. So it's cool to get to learn all the different types of careers that are in the hospital. I think that's really amazing.